cervical cancer. So the power of early screening and early detection of cervical cancer. So with me in the building, I have a wonderful guest. This is no other than Dr. Waison Munga, who is a national focal point person for maternal health. Dr. Waison, good evening.
Good evening, Amalango, and how are you?
I'm very fine. Good to see you after a long time.
The pleasure is mine to be with you on this set.
Okay, thank you. I wanted now to ask, who is Dr. Waison Munga, and what is it that you really do?
Thank you very much. Dr. Waison Munga is a consultant obstetrician and gynecologist working at the women and newborn hospitals of the university teaching hospitals, and also the national focal point person for maternal health that is in Zambia. Yeah, of course we do one or two other things of our own, but I'm also an advocate of healthy, public education, and I think I do quite a number of programs with media, both radio and TV.
Oh wow!
On different platforms, and and I think I love at any opportunity that is offered to kind of share a little that we know about this healthy lifestyles and so on.
It seems you've got a lot on your plate. Do you even have free time for yourself? Any hobbies apart from?
I doubt if there's any free time under the sun, because I don't think so. It's how you manage time. I think we have grace enough to manage the time.
Exactly. I agree. I think I'll need a tip on time management, because I seem to be dragging into the next available program that I'm supposed to do, like there's a clash and conflict. Okay. So we are now talking about cervical cancer. I wanted to really ask what cervical cancer is in general, and what we can just educate the women out there on what it really is.
Thank you very much. So I think we'll break down the words in the cervical cancer. So cervical is coming from the word cervix, which is a part of the body, and it's part of what people call the private parts, but it's basically the neck of the uterus. Okay. So the uterus, or womb in layman's language, is up there in the tummy, but then it hangs inside the private part of a woman through this neck called cervix.
The cervix.
Yeah, and cancer generally, we are talking about abnormal multiplication of cells. Yeah, so each cancer disease is taken after the part of the body that is affected. So when we are talking about cervical cancer, we are literally talking about abnormal multiplication of the cells of the cervix, which is that hanging neck of the womb inside, up there in the private part of a woman. And then this cancer, before it even becomes cancer, in fact, it should not even become cancer.
Exactly.
I think let's start from there.
Yes.
Yeah, because the cause of these cells to start to become abnormal in the way they are multiplying is by the presence of a virus called human papilloma virus. Human papilloma virus. There are different types of human papilloma viruses, but there are other specific ones that would lead to cervical cancer if not taken care of.
Exactly.
And then the other types would lead to warts and other things.
Okay.
Yeah, so generally the human papilloma virus is transmitted through sexual activity. So from word go, Malango, and all the viewers, is that it's important to note that any woman that is involved in any sexual intercourse is at risk of contracting the human papilloma virus, which after many years can transform those cells to start multiplying abnormal and become cancerous. And because it's on the cervix, then cancer of the cervix. This then takes us to the understanding that there's a long time of the presence of this human papilloma virus on the cervix before it actually becomes cancer. And we call that pre-cancerous.
Oh, okay.
Okay, meaning there are changes that do occur even before it reaches the stage where it is now become cervical cancer. So that's called pre-cancerous stage.
Okay.
And that's where our emphasis shall be this evening, talking about why screening is important, because the screening can detect the non-cancer or even the pre-cancerous, the before cancer stage, which are very easy to deal with, and so on and so forth.
Wow. This is really beautiful, and indeed I'm really learning a lot. So having talked about all this, the pre-cancerous stage and all that, is cervical cancer preventable?
Excellent. So remember, we are saying that you can have human papilloma virus on your cervix, and it can sit there for years, sometimes even self-resolve if your immune system is very perfect.
Wow.
But again, other cases, you may have this human papilloma virus on your cervix and start causing changes that are before cancer, pre-cancerous. The pre-cancerous stage, if not attended to, then it can now progress to the cancerous stages. Okay, so basically cervical cancer is 100% preventable.
Beautiful. So are there, apart from the cervical cancer screening, what other mode of preventive measures do we have here in Zambia that we offer?
Okay, thank you very much. So remember that we said that the human papilloma virus is transmitted through sexual activities. Okay, so for our young generation, the youths, our girls, please, one of the most effective preventive measure of contracting this virus, even before we start talking about cancer, is delay your sexual debut. Do not rush into sexual activities. So the more you delay, the more you are preventing yourself even from coming into contact with the human papilloma virus. So number one, okay, delay your sexual debut, young people. Those that have already started engaging in sexual activities, stick to one partner. So number one, abstinence is one of the best preventive measures for the young generation. And then the second one is avoid multiple sexual partners. Avoid multiple sexual partners. Okay. Number three, for our male folks, okay, circumcision has also been found to be helpful in prevention of cervical cancer. Okay. Number four, if you have any sexually transmitted infection, please make sure that you are treated. Okay. Number five, make sure that you know your HIV status, because once you are HIV positive and you don't even know your status and your immune system goes down, the rate of progression of changes into cervical cancer is so fast and rapid.
Oh, wow.
For now, I think we can end there.
Oh, wow.
Yeah.
This is actually very, very beautiful. And I love how they are building on each other, from abstinence, one sexual partner, male circumcision. A long time, especially on the part of male circumcision, most people used to think, no, this is according to tradition. But I love that there's also the medical approach to it.
Thank you.
So having dived into the causes, I wanted now to find out on what are the effects and of cervical cancer if left untreated. So
remember, cancer on any part of the body is very dangerous. But for now, we can look at how big and serious this problem is in our country. So in Zambia, of every 20 to 25 cancer cases, okay, so in short, we are saying that about 20 to 25 cases, okay, of, if we take a population, we say per every let me just say about 20 to 25% of all cancer cases, apparently they happen to be cervical cancer. It may be in the ranges of 23%. I've just put a wider range.
Okay.
That's a very high risk.
Exactly.
And then the incidence, meaning that the rate at which there are new cases being found with cervical cancer in our women that are screened or seen, 55 in every 100,000 women are found to have cervical cancer in Zambia.
Wow.
55 per 100,000 women are found to have cervical cancer in Zambia. Now, coming to the worst and bad news is that about 43 of every 100,000 women will die of cervical cancer in Zambia. That's a very high statistic.
Exactly.
Okay.
Yeah.
So in short, one of the most deadly or fatal or one of the most deadly condition that we have for our women, cervical cancer is among those. That's how serious it is. Now remember that if you have not screened, it means the precancerous stage has been skipped. It has not been detected before it becomes cancer. When it becomes cancer, number one, the progression is faster. You will have a poor quality of your life because your life quality will be compromised now by the complications of the cancer that has set in. Now give some examples. We started with the last risk, which is death.
Yes.
But when you have cervical cancer and is developing on your cervix, you will start having abnormal bleeding as a woman. You can be spotting continuously, or bleeding. You no breaks in bleeding, and you keep losing blood until you become anemic, and the anemia can complicate into heart failure, kidney failure, and so on. Others die of the anemia itself, others will die of the complications of the anemia, heart failure, kidney failure. This cancer also can spread to other parts of your body. And just break you down. You have weight loss. Even if you are eating, you have weight loss. This bleeding issues, backache, you have foul, smelling smells. Like rotten smell from the cancer cells on your cervix that have become bad, and like your cervix is basically rotting. And that cervix and the affected cells will keep growing, not just on the cervix, it will spread. It will affect your lining of your private parts. Others you examine, you find there's just a mass filling the whole private part. And it has become even like rotten. It can even snap off when you touch it. Just any contact, there's bleeding. Bleeding even when you are meeting with your husband. Any contact on the cervix will cause bleeding. Now think of the poor quality of life. Other than that, in a 5 to 10 years lifespan, you risk dying if you are not treated. And then the expense that comes with treating the actual cervical cancer.
That prevents.
Now it's very expensive, number one. Others, if it's early enough, they may have to undergo very complicated and expensive surgery operation to remove the uterus, the cervix, and all the other parts where it could have risked to spread to. You talk about radiotherapy, and in the current scenario where we are not able to give radiotherapy as a country, whether it's government or yourself, you need to find money to travel abroad to receive your radiotherapy. Even if our radiotherapy services are available, there's a queue It's a lot of women now, now undergoing radiotherapy that also has its own complications. You understand?
Yeah.
That's how complicated it becomes if we leave it to the cancerous stage.
Wow.
If we screen you and detect it in the pre-cancerous stages, the method that is used to treat you is readily available.
Exactly.
Very simple, Malango and the viewers. Very simple, very cheap, readily available. It will not inconvenience your life or your business or whatever you do, and it's test and treat.
Oh, wow.
Right there, you pick that these are precancerous cells.
Yeah.
You just freeze, put something on your cervix, and then the cells are frozen. You are done.
Wow.
Okay? And sometimes you just cut the piece of the cervix that is affected, and you are done.
Wow.
Right there, test and treat. And the program we have in Zambia for cervical cancer, the prevention, cervical cancer prevention program in Zambia is one of the largest in the sub-Saharan Africa. So the stage is set for you, our women, to simply walk into our health facilities free of charge, no complications, and it's mainly a nurse-led program. The treatment will not require for you to be given an appointment or the doctor, whatever. It's nurse-led.
Wow.
And it's spread around the country for God's sake. Why not screen?
So these are all already at our disposal, and most people,
telling you, and so it feels bad on our side when you sit on the other side where we sit to see women come with advanced cervical cancer. It feels very bad.
Exactly.
Because now you are saying, where was this woman? Or where were we ourselves? Why didn't we encourage them? Why didn't we reach out to them, to screen? Probably they should not have developed this cancer.
Yeah. Oh, wow. So it's already at our disposals from every part of Zambia where we can go for the cervical cancer screening.
Yes,
because I believe there's one which is very effective. In less than 10 minutes, you even get your results there and then.
Yes.
Yeah. So having talked a bit about the treatment option where we do the freezing if it's in the precancerous stage, what other treatment options do we have for cervical cancer?
Thank you very much. So the treatments that are there depends on what stage
the cancer is.
So for example, the precancerous, of course we mentioned the freezing, the cryotherapy. So in short, there's thermal ablation and whatever, cutting off and so on and so forth. Then there are others where the cancer started developing, but it's not yet spread far away from
the cervix.
And the size of the affected part is small. Those, they are treated by an operation.
Okay.
Where you operate basically to remove the whole uterus together with the cervix. Okay. Sometimes including a small part of the upper wall of the vagina, the private part. Okay, and so on and so forth. And for others, just the surgery will be adequate. Okay, and you are done. But we don't want you to have that cancer to reach that stage. And so beyond a certain point, you will then need to go for radiotherapy.
Okay.
Radiotherapy in Zambia, bakambati kuvimalaiti, cancer. Basically, what you mean is that you want to project this special light carrying radiations. Okay, it's a beam of radiations, but in ordinarily you would say chilight. So when you insert it in the private part and then you project the radiotherapy rays, so then the cells that come into contact with that radiotherapy will be destroyed. So that all the cells that have become cancerous will be destroyed, so that the normal cells remain. Now that's the radiotherapy that is done at cancer hospital, and we are praying that we should get back on board,
yes,
having this treatment locally, because it's quite costly and very psychological and emotionally traumatizing to be told you have cervical cancer that requires radiotherapy. And then you need now to wait on the list. When am I going? And remember, cancer, we said it's abnormal multiplication of cells. So you don't know again how fast they will keep multiplying and how advanced your cancer will be becoming. Think of the anxiety.
Oh wow.
You understand? Yeah, so those are the issues. Otherwise, better treated before it is cancer.
Okay. Oh wow. If you've just tuned in, this is a live and a phone-in program. This is the Teledoctor Show that airs every Tuesday 17 to 18 hours on Diamond TV. The number is displayed on the screen. Please feel free to call us and ask us about this cervical cancer. Our topic today is cervical cancer, the power of early screening. All right. Welcome back, and thank you. We're talking about cervical cancer screening, the power of early detection. So earlier, before the break, we had to talk about a lot of things on how we can even prevent the cervical cancer, knowing that it's preventable. So among those options that we were given, Dr. Waison Munga, I want to ask about the vaccine. Who is eligible? Can me, who's above 20, go for the HPV vaccine, or who is eligible for that?
So HPV, human papilloma virus vaccine, in short, is one of the preventive tools that fortunately we have incorporated as a country. Yeah. So basically it's meant for people that have not had sexual debut. They have not had sex.
Yes.
Yeah. So it's it has been not an easy criteria to come up, but for our country we have agreed that girls aged between the age of girls aged 9 to 14 should be eligible. The assumption is that in this age group we should have our girls that are still innocent and not exposed to sex. So in other countries like in Europe, the age doesn't matter. As long as you haven't had any sexual debut, you can be in between 5-30 you can still receive the HPV vaccine. But for our country, we have devised that girls aged between the age of 9 to 14, usually these are school going. Even if they are not school going, but they are in this age group, then they receive the human papilloma virus vaccines. And please, this vaccine is tested and proven to work for many years. And this program started a long time ago in other continents before it came to us. So don't look at it as a strange happening. Let's protect our girls.
Very true. So when they receive, do they have to receive again, or it's just a single dose?
No, there's usually you receive and then there will usually be a repeat dose.
Okay, so after like how many years?
The vaccines are different. Yeah, so it depends on which vaccine you have received and you'll be given the schedule. Okay. Yeah.
So beautiful. When we were going to school, the only vaccine that we knew during my time was the tetanus toxoid, which we used to receive. I'm happy that there's the HPV. I wish I was eligible to that, but hey, I'll be encouraging the other women out there, the 9 to 14 years to come.
So remember, with the vaccine, you should not have had a sexual debut.
Yeah.
So if you are in the normal family way or whatever, remember your part. Or if you've had any sexual debut, then your role is not the vaccine. It's cervical cancer screening. Thank you.
So now, having talked about the cervical cancer screening, I'm glad we've headed in that direction, because I wanted to ask, like, what methods of screening are there? And we have a lot of myths and misconceptions. I'm sure we still have a very low turnaround of people coming for the cervical cancer screening.
Thank you very much for that very important question. So first of all, I want us to understand that despite having one of the best cervical cancer prevention programs in Zambia, which is usually NES-led, we are still lagging behind in the utilization of this robust program.
Okay.
So
sorry, Dr. Munga, we have someone, a caller there. Yes, Precious. Good evening.
So I want to ask some questions.
Yes, Madam Precious, please go ahead. Padibe voto mami mungakambe mungafunzi. I'm not hearing. Okay, kambisani mama stinamvela question. Nyamlan con voice.
Kama ngati ndio mkazi so ngalikina maizi ngati kushita period.
Oh, okay. Okay, zikomo mami tamvela question 9. Yes, tayamikila.
Okay.
Okay.
That's okay.
So, Madam Precious's question is, she's asking when one can stop having her menses, like menopause.
Yeah. Thank you.
Yes.
So, a quick answer to our caller is that the age of menopause, generally speaking, can be anything from 45 to 55 years.
Okay.
That's the age of menopause. Though in Zambia, our average usually is between age 48 and 52 or 53. But anything from 45 to 55 is okay.
Okay.
So others it can stop early, a bit early, others a bit late, but as long as it's within 45 to 55.
Okay. There you go, Madam Precious. I hope Mwamvela, my uncle I'm still learning. At least my nyanja has also improved gradually.
Thank you.
Yes. So before we had our caller, we were talking about the methods of cervical cancer screening and the myths around that.
Yeah. So I was saying that despite having one of the best and largest cervical cancer prevention program in the sub-Saharan region, we are still lagging behind in the utilization of this available program and services.
Exactly.
Such that as a country, we are somewhere around 26-27% uptake of the cervical, cancer screening services. It's very low. Who is contributing to those low percentages? It's you, our woman, listening to us.
We are culprits.
Go there. If you are a woman, be part of the improved statistics for your own safety.
Exactly.
Go for cervical cancer screening. And a lot of women have a lot of information, but just the courage and the boldness to say, today I'm going for cervical cancer screening, it lacks.
Exactly.
It lacks. They'll just be hearing, no, this one was screened, my friend, you screened. But what about yourself?
Exactly.
Have you screened? Okay. So please, we are still low. However, the methods that are used for screening in Zambia are very simple methods, and we'll talk through the various methods.
Exactly.
And the beauty with a screening method is that it's usually very simple, it's very reliable, it's very accessible, and it's very cheap.
Exactly.
Okay, so among those that we have therefore in Zambia, the commonest that we use is called the visual inspection with acetic acid.
The common VIA.
VIA. So VIA is the short form of visual inspection with acetic acid. So what it is that there's acetic acid or vinegar which is diluted and made for the purposes not
consumption from
consumption. Is meant specifically for this purpose. It's medical vinegar. Okay. And so you soak your cotton swab in this vinegar, and then you expose the cervix. Then you are in contact with the cervix for about 3 minutes or so, and then you remove the cotton. Then you observe for color changes. If the cells are anywhere near beginning to change to become precancerous before cancer, then you are able to see a color change.
Oh, wow.
You will have what we call aceto white. Aceto white, you see whitish coloration because the cervix is supposed to be nicely pink. Even if you had your vinegar touching it, it's supposed to be nicely pink. But when there are changes happen
Sorry,
to the
Dr.
cells,
Munga, hold your thought. We have another caller. Today you are on demand. Hello, good evening.
Hello.
Hi, Mr. Mutambo Aaron.
Hello.
Hello, Mr. Aaron. You're audible.
Hello,
We can
how are
hear
you?
Fine, thank you. Please go ahead with your question.
I'm good. Yes, I'm good.
yeah.
Okay. Okay, kindly
The
reduce
question
the
I
volume.
wanted to ask is that when you are sick from cervical cancer, can you be healed?
Reduce the volume from your background. We're getting an echo feedback.
Okay, so he's asking if you can be healed when you have
What's your
cervical
question?
cancer.
Okay, I think we've gotten his question. Thank you so much, Mr. Mutambo. His question is, can you be healed if you have cervical cancer?
So cervical cancer is treatable, but the most important is that it is preventable. I think we'll end there.
Exactly.
Thank you. So
Yes,
we were talking about the screening methods. So the visual inspection under acetic acid or with acetic acid is as I was explaining. Yeah. So now to look at the cervix, it needs to be exposed.
Yeah.
So there's a small metal piece. It's designed for that purpose, not to hurt you. Okay? It's called the speculum. So
Everyone's fear.
so it's called the speculum. It is designed for the purposes of gentle insertion into your private part, and when it is opened, then the person outside is able to look at visualize your cervix, or to look at your cervix. Then we'll get a cotton swab that is dipped in medical vinegar, acetic acid. Put it there 3 minutes or so. Remove it and observe for color changes. If the cells have not changed in any way, they are as natural as God made them, your cervix will be looking nicely pink. all round. But then if there are pre-cancerous changes, the cells now are starting to look to change in a certain way that if not attended to become cancer later, it will look like whitish colorations. We call it aceto white. Now, to enhance the correctness of what we are seeing, there are even cameras to enhance the picture. Yeah, so it's called the digital cervicogram. Because others now are surprised they are even getting pictures. Okay, so it's true. That picture can be referred to by yourself, it can be shared with you, or in case maybe the medical personnel that is screening wants to consult, they are able to send the picture, and you consult even from a remote village. You can send the picture to someone in Lusaka and say, hey, look at this picture, this is what I'm having. What do you think? Okay.
Moreover, those pictures don't even have our faces. It's just the cervix.
Yes.
So you can't know whose cervix and this was for.
Okay. Yeah, so that's the commonest method. The visual inspection with acetic acid, usually coupled or together with the digital cervicogram, which is just a picture, which can be used for many purposes. You can store it yourself. You can keep your picture and later on show somebody like, oh, this was the picture of my cervix. Or for consultation purposes. The other method is also visual inspection under Lugos iodine. That's another type of solution. Okay, but then there's also another digital method where you use an enhancing microscope kind of so it will multiply the size of the picture of your cervix, and then see if you are able to see the pattern of the blood vessels on your cervix. Okay. Yeah, so that is also another method. And then there's also the method of just detecting whether there's actually the presence or absence of the human papilloma virus.
I've told you you're on demand today. We have a caller all the way from Chinsali. This is beautiful. I love this. Good evening.
Hello, sir.
Hi, Mr. Angel Musuku. You can please go ahead with your question. You're through to the TeledoctorShow Show.
Good evening.
Kindly reduce the volume on your background. We're getting feedback.
My question is that my mother is sick of cervical cancer.
Mm-hmm.
My question is that my mother is sick of
Yes, Mr. Musuku.
I just wanted to ask if she can be healed or what.
Okay. Thank you so much for your question. All right. So thank you, Mr. Musuku, all the way from Chinsali. It's good that you've tuned into the TeledoctorShow Show, and we're going to also answer your question. I'm sure you've just tuned in now because at the beginning of the program we emphasized on the question that you've asked. But I will leave it to you, Dr. Wyson, again.
So cervical cancer is treatable. Mm-hmm. The treatment becomes more complicated as the cancer is advanced.
Yeah.
So I hope that your mother is in the healthcare system, and there should be efforts to treat her. And we pray to God that it's at the treatable stage, otherwise it is treatable.
Exactly.
Yeah.
Thank you. So we were still talking about the methods.
The screening methods.
Yes,
so the other method that we were talking about is getting a sample from your cervix, just a swab, and then send it to the lab. Yeah, whereby now at the lab we'll look for the presence or absence of the human papilloma virus on your cervix. So it's called HPV DNA. You are actually testing for the presence of genetic material from the human papilloma virus itself that causes cervical cancer. Then another method that you can probably use, and this is a cytological method, that's our language.
Yes.
Cytology simply means you are looking at the cells now.
Okay.
So where you get a brush, brush on the cervix, take those brushed cells now to the lab, and someone looks at the microscope to look at what type of cells are there. Are they normal cells of the cervix, or have they started showing signs of changing? Okay, so that one is called pap smear.
Okay.
That's the pap smear, where you take a brush, just brush a bit on the cervix, and you expect that the brush would have picked some normal, some cells. Go and look at them in the lab.
Okay.
Are they normal cells or what? Okay. Yeah, and then for some other cases, especially where you suspect that there's something, you may actually cut a small piece from the cervix, and that's called biopsy. So you can do a cone biopsy, or you can do what we call LEAP. So you use an electrical
Sorry, we have another caller, Dr. Munga. Hello, good evening, Mr. Francis.
Yes, good afternoon, good evening, madam.
Thank you so much for calling.
My question is on the same disease, cervical cancer.
Yes, sir.
Yes, I think myself personally, I want to know the cause. What causes cervical cancer in women?
All right.
Is it an infection from men, or it is just in families? I want to know that. Thank you very much.
Thank you so very much for tuning in all the way from Kitwe, Mr. Francis.
Please, Diamond, you are doing a good job.
Thank you so very much, sir.
Okay.
All right, so Mr. Francis from Kitwe is asking what causes the cervical cancer. I'm sure most people have tuned in late, so we'll still be taking you back for the sake of spreading the information.
So, Mr. Francis, at the beginning of the program, we stated that cervical cancer is caused by a virus called human papilloma virus. And this virus is usually transmitted through sexual activity. It is not a genetic disease. It does not run in families. Okay, you should have been exposed to this virus as a woman, this virus called human papilloma virus, for you to develop cervical cancer if screening was not done. Because if it was done, it would have been picked or detected before it becomes cancer, and it would have been cut off.
Exactly.
So in short, what we are emphasizing is that no woman should have cervical cancer. Should every woman screen?
Exactly.
Okay, thank you very much. So we were talking about pap smear as a screening method, and then we also talked about visual inspection under acetic acid, visual inspection under Lugoza iodine, colposcopy, that magnifying camera to see if you can be able to see blood vessels and so on the cervix. Then we have the cone biopsy, where you slice off a part of the cervix that is looking suspicious, take it to the lab so that they tell you if there's cancer or not.
Okay.
Yeah, so those are some of the screening methods for cervical cancer. But remember, other screening methods may seem so complicated, but we have very simple ones as well. And in Zambia, we are using our primary screening tool as the visual inspection that can be done at any point in any part of this country by our simplest healthcare providers that are trained. And remember, our program is nurse-led.
It's nurse-led, and that's the beauty, because at least every time there's always a nurse available.
Thank you.
I wanted to ask about certain practices that women do, and do they predispose to getting cervical cancer? The methods that I've heard of is snuff insertion in sunko. Others, they put in anything, ice cubes, and what can you comment about such vices? So
the risk factors for cervical cancer, we will lump them. Number one, if you are a woman and you are having multiple sexual partners, you are in danger. One of your partners may just carry the human papilloma virus and smear on you. So stick to one partner. Exactly. Avoid multiple sexual partners. The other risk factor is also having too many children.
Oh, wow.
So the part of the cervix where cancer starts from, cervical cancer, is a specific region. So the more children you have, that area will be exposed to the acidic environment of your private part, and it can easily start changing with the presence of human papilloma virus. Okay? The other risk factor, as a woman, always know your HIV status, so that when you must know, so that in case it's HIV positive, you are on treatment so that your immunity is not low. Okay, the other thing, all our women, please stop smoking. Smoking, it doesn't matter which method. Whether you are sniffing in your nose, you are using your mouth, you are inserting things called sunko and whatsoever. The effect is the same. Smoking is carcinogenic, meaning smoking is a risk to causing any form of cancer. Including cervical cancer. Okay? Yeah, and avoid putting wrong things in there in the name of sexual enhancement. You are packing things in your private part. Those are chemicals that, even as chemicals themselves, can start making changes to the cells of your cervix, and when the virus is there, your human papilloma virus, it will just take advantage.
Wow. So this is really beautiful, and today we've seen that even time has flown. Okay, so in your last words, Doc, what is it that you're going to encourage us?
Before my last words, I'm looking at your time. Before the last words, I want to say that do not be cheated. Be wary of the myths that are there that are preventing you from going to be screened for cervical cancer. And imagine someone has screened themselves, they are even negative. Then they come and tell you, it wasn't good. They know their results. They are negative. Then they are creating fear in you, who will not screen and may be a victim of cervical cancer. So some of the myths include, number one, they will say, no, you can actually get the virus from the things that they use to insert in you. 100% false or wrong. Others will say after cervical cancer screening, you will be bleeding. 100% false or no. Others will say when they insert that metal piece in you, your woman would remain larger and big. Force, 100% force, and wrong. Others will say it is very painful when they are inserting that metal thing. It is force. If you feel any discomfort when the healthcare workers are inserting that, be open. Just say, I'm feeling uncomfortable. They'll always adjust and set it nicely. It was designed for that purpose. Take home message. Okay? Prevention is better than cure. We are lagging behind, yet we have in screening only 26%, yet we have one of the best and largest programs for screening cervical cancer in the sub-Saharan region. Please, we are counting on you that we prevent something that is preventable in you. Add to the good statistic. We love you, our women. God bless you. Make sure you get screened if you have not yet gotten screened. Thank you.
Thank you so very much. And we've come to the end of the program, but do catch us tomorrow at 9 and 10 hours on Radio Phoenix. I've been your host today. My name is Sister Malango Goma, and we're signing out. Have a pleasant evening.